Yeah, I've had a chance to really meet and work with a couple of you guys throughout the last couple of days. And, I love the alignment. I love the passion. I almost feel like I'm on a parallel universe. And Josh from Access Care, he's the one that brought that up because we're trying to solve the same problems. And we're around the same people that have the same passion. We have software vendors, we have supply vendors, and yet we're trying to solve problems for the aging services world. And you guys are doing it in the community setting. We're doing it out in the community setting, in the home setting. But one of the things that I really learned a lot from the Influence Group and the Home Care Innovation Forum, I've had a chance to attend 2 of them. And the very, very first one, we had Daryl McDaniels from Run DMC. Maybe you guys have seen him. And we had Mark King. And the one thing that they said that really resonated with me was, in order to innovate, you have to collaborate. And the collaboration is not only just with the vendors and the people that are in the other room that are trying to provide services for us, but it's a collaboration between all of us here in the room, but it's also a collaboration with all the stakeholders. And the stakeholders are everyone that is in the aging services world. And I think, us being aligned together is really critical. And I'm just honored here to talk to you about home care and really how I see a world where we can work together and we can make aging successful as it can be for older adults. So I want to share a couple quotes with you. Everyone knows Atul Gawande. The challenge is not how to provide care, but how to provide it sustainably and ensuring the costs don't eclipse the quality of care. Angela Duckworth, when it comes to funding our future care, perseverance, and planning are key. We must be proactive, not reactive, in how we approach the costs of aging. And then Marilyn Taverner, she was the former administrator for the Centers of Medicare and Medicaid Services. She said, aging is inevitable, but how we finance the care of our elderly population is a choice that requires strategic planning and innovative thinking. Rob, I appreciate you bringing up the fact that we have a population challenge. We really do. I mean, the 65-year-old population between now and 2050 over the next 25 years is going to double. The 85-year-old population is going to nearly quadruple. And for us to keep the population that we have presently at 345 million Americans, every child-rearing female needs to have 2.1 children. We're at 1.7 now, and we're declining from there. So hats off to the innovation, the thinking outside the box, the Ghanaian population, the Tongan population, the Filipino population, the West Indies population, the Jamaican population. There's so many caring cultures out there that we have to figure out how we can bring these people across over to where we're at. You guys do so much. And we talk about labor, and labor is really hard. I mean, I'm in the home care business, and I have to worry about caregivers. You guys have food service, you have housekeeping, you got engineering, you got care, you got administrative tasks, you've got a whole plethora of employees that you employ. And one of the things that I really feel like we can help you guys with is the care side. And for home care owners like myself, we've had to reimagine the way we deliver care. So what I'm here today to talk to you about is on-demand, fractionalized care and how we can partner with senior living communities. And we're doing that right now in the Phoenix metropolitan area. So a little bit about me and Cypress. Rob, I think you shared all of us have stories. I mean, my story is that I was a caregiver for my mother. 1985, she suffered a major heart attack and never was quite the same. She spent nearly 2 months in the hospital, 18 days in a drug-induced coma, and my brothers and I found ourselves as accidental caregivers. 1985, assisted living wasn't really around, guys. And there really wasn't the concept of in-home supportive care services, which is really how I like to call our industry. Some people call us non-medical, some people call us non-clinical, some people call us private duty. What we really do is we do in-home supportive care work. So we've built at Cypress a culture of innovation, and we started Cypress in 1994 with the premise that we would be those extra hands and feet and eyes and be there to care for people, primarily to provide respite, because we knew how hard it was to be a caregiver for my mother. By the way, she lived almost 18 years after that heart attack. Got a chance to see 3 boys get married and got a chance to see 9 grandkids. Quality of life wasn't great, but she is the inspiration. She's the driving force of us starting this company. So we started in 94. 2004, we built the very first home caregiver training lab. We trained not only caregivers inside our community, but we also trained caregivers outside in the community itself. So acute and post-acute providers knew that they could come to us and we could help family members have those skill sets. We had 16 pieces of medical equipment, 2 hospital beds, 2 life-weighted mannequins and life-size mannequins, Hoyer lifts, you name it, so people could learn. In 2014, we stood up a dementia program, and we got a lot of awards for doing that. Dementia is a real skill set that you have to have with caregivers. We didn't have quite the tools that we saw this morning. Certainly, I'm going to look to adopt those for our caregivers. And for us, we've been around 30 years. We're the longest holding company or home care company in the Phoenix metropolitan area for the last 30 years. And really, what's been our route to success is trust. We have to build trust with the clients that we serve, but more importantly, we got to build trust with the referral partners. And what do I mean by trust? When a care recipient opens the door to a caregiver, they open their life to them. And really, that life is something that's very precious, and there's a lot of trusting that needs to happen with that. So, introduction for on-demand care. We know the numbers. I shared this with you guys before. 65-year-old population's doubling. We're going to have, actually, this is an Arizona number. In 2030, we're going to have more people 65 and older than we are going to have an 18 younger. We're one of the oldest graying states, and it's happening right before us. I mean, we see Japan. We know what Japan's going through. We know what South Korea's going through. But in our country, Arizona is one of the fastest aging populations. It's the fourth leading cause of death in Arizona is Alzheimer's, where it's the 5th leading cause in the United States. So I don't have to tell you guys, the cost of care has gone up so exponentially. It's crazy how expensive it is. I have these dates that I had up there, 1994, 2004, I had 2014, and certainly 2024. To give you an idea, the cost of our services, I'll just take the little window between 2019 and 2024, has gone from average of $27 an hour to $40 an hour. Who can afford that? And the biggest challenge that we have right now for solving this is to be able to make it affordable. And there's nothing harder than working with a senior living community and telling them, hey, we can help you, but our caregiver has to have 4-hour minimums or has to have 6-hour minimums. That doesn't work. It doesn't work, so we have to reimagine how we deliver care. So there's a chart here. You guys know Genworth. Genworth puts out that cost of care report every single year. It's not exactly 100%, and I think you guys know that, but directionally it works. And if you haven't gone to the cost of care, you can zero down by city, you can zero down by zip code what the cost of assisted living is, what the cost of skilled nursing is, what the cost of having a home care agent or a home caregiver there. So older adults want to be able to thrive in a place that they call home. Senior living communities are rising to meet the needs of the generation. I'm a boomer. I fell in the bottom half or the back half of that boomer era. The suburbs were built for boomers. I mean, if you study and you're one of the boomers or you talk to your parents, everyone migrated outside the cities to start these suburbs, and schools were built, High schools were built, churches were built, synagogues were built, municipalities, parks and recreation, all of that was built through the boomers. Now we're dealing with boomers aging, and we have to think differently. And that's what I love about this conference is we get an opportunity to really think differently, and we get a chance to hear from people who are doing things differently. So for us, we want to be able to figure out how we can serve this population and help you do it as well. So certainly, families are really struggling. The average distance between an adult child and a parent that is needing care is about 280 miles. So the nuclear family that we knew of back in the 1950s and the 1960s doesn't really exist. Children live in other cities, they live in other states, maybe even other countries. So how do we do this? Well, we figured that we would come up with a solution, and it is Cypress on-demand care. And utilizing on-demand care gives an opportunity to provide care in your community for your residents at very small increments. We do care by 15-minute increments. We bill by the hour, or by the minute. We bill by the minute. We see a need out there. We know people need care, and we want to be able to deliver care in the comfort of what they call home. And they don't need 4 hours. They just might need to get down to dining. Listen, 1/3 of our population, 65 and older, lives home alone. In your communities, it's nearly 2/3, if not greater, that are living home alone. And we know that hygiene is a real big problem. And hygiene is a problem because if you sit down and you talk to the residents, they don't want to take a shower because they're scared. They're scared that what happens if they slip and fall? Who's going to be there? I mean, we're doing those bathroom or shower assists. We're doing those visits where we're opening mail. So no better person to really talk about this than my manager of Care Innovations. So I'm going to introduce you to David Sachs. He couldn't be here with us today, but I'm going to let him take you through this model of care, and let's see if it works.
Hi there. My name is David Sachs, Cypress Home Care's manager of Client Care Innovation. And yes, it's a real bow tie. Before I moved to Phoenix in 2014 and got bit by the bug of working with seniors, I had the privilege of working at a public policy institute housed in the former Upper East Side home of Franklin and Eleanor Roosevelt. It was there in the second floor drawing room where in 1933, the newly elected president deliberated with a team of advisors, including Francis Perkins, over the desperate conditions facing the country's relatively small older adult population during the Great Depression. The innovation they created, introduced to the world as Social Security, saved countless individuals and families from the despair of aging without supportive assistance. Today, the need is exponentially greater than it was then. We're living longer, more engaged lives, and we want to retain our independence and our dignity as we age in a place we can call home. For nearly a decade now, the senior living and in-home supportive care industries have been faced with existential crises centered around the topic of workforce. We knew then, as the first baby boomers turned 70, what we know now, that we are at an inflection point. The aging boom, coupled with the rising cost of labor, has sent the cost of care beyond the means of most Americans. This is where the inspiration for on-demand care began. On-demand care is care by the minute, provided by caregivers who are dedicated to the care of residents in a single senior living community. Take a moment to let that sink in. Across the in-home care industry, commitments of 4 hours per visit and 12 to 20 hours per week for each of our clients are the norm. On-demand care allows us to provide the same supportive services our hourly care recipients enjoy in visits as brief as 15 minutes with no additional commitments required to sign up for service.
I'm going to give a couple testimonials. We're in 5 communities in the Phoenix metropolitan area. This gentleman, John Scott Williams, he was the executive director. He's been there for almost 30 years, and no one has actually filled that position, but he feels like they need to groom somebody, and he's now called the vice president of operation. But Guy's brilliant. If you don't know John Scott Williams, he's a guy you should know.
On-demand care came up after a conversation I had with Bob Roth and Dave Saxon, where they had this idea that they'd come on my campus and take care of the group that I have the hardest part taking care of. That's independent residents that need some care, but they don't need assisted living. Many of our residents love the idea that they can be in their apartment and get a qualified caregiver who is fingerprint, background checked, is a full employee. We know that they're paying their taxes and that they have liability insurance. If you're hesitant, if you want to know what it looks like, come out to my community and you can see how my residents respond to it. We make it very prominent. Cypress is our #1 referral. That's the only organization that we allow to advertise on our in-house TV, and it's in all of our materials. This is who we endorse, and we endorse it because they earned that endorsement.
You know, the biggest challenge he has, and many of you have, is you have a lot of these independent, he calls them fleas, independent contractors that come in because they have been with these residents prior to, or these residents have recruited them, and they don't know who's coming, they don't know who's going. The chance of them being licensed and bonded and insured is not really good unless you as a community are mandating it. And the nice thing about engaging an agency like ours is that we're an employer-based agency. We have all those protections. We have all the training. We have the supervision to really make sure that your residents are protected and your butt is protected from a liability standpoint. Here's a testimonial from Leading Age President of Arizona, Jamie Roberts.
So I'm Jamie Roberts. I'm the CEO of Arizona Leading Age. I have been working in senior living the majority of my career. I'm a licensed nursing home administrator, assisted living manager, dementia educator, and consultant. And I'm a published author, all in the realm of senior living older adults. I would say the average entry for very basic care, not a whole lot of extras, is about $4,500 a month. And that's if you're very independent. I mean, you know, if you're looking for somebody who needs, there's some memory support services or some brain change issues, you're looking anywhere between $7,000 and $10,000 a month. If you look at isolation and loneliness and depression and all of those indicators, having somebody come in at least once a day to check in for 15 minutes to do whatever needs to be done, there's a positive impact on that. We can come in, do 4 hours a day, 6 hours, 8 hours a day, and the families are paying for that large amount of time for this one caregiver to come in. The resident might only need help with morning showers and breakfast, or they might just need help with groceries or walking the dog or doing some laundry and some basic companionship. And that might only be an hour of time that they need, and or a ride to the doctor or something like that. They don't need all of that extra time. So the family's ending up, they're paying for 6 hours to 8 hours of care a day when they're only needing a fraction of that amount.
And I'll conclude with this last slide because, Mike, I appreciate you letting me finish out. All right, let's see if I can get to go. So I want to give you the data because let's face it, it's all in the data. You know, 1 year snapshot, we're working in 5 senior living communities. We've delivered 3,000 hours of on-demand care, 1,000 unique visits, dozens of activities of daily living. Many falls have been prevented, hospitalizations and readmissions avoided. 15-minute minimum. We're averaging 47 minutes per visit. And I never thought that number would be that high. But let's face it, 2/3 of them in your communities are home alone. And the companionship is really important. You know, look, babies get touched 100 times a day. And we have older adults that are lucky if they get touched once a day, let alone once a week. So here's my concluding video.
Working closely with community staff, community health centers, and healthcare practitioners, we're able to pinpoint care needs as they emerge and address them head on, helping to prevent falls, hospitalizations, and hospital readmissions. As we look to the coming year, we see a new era for in-home supportive care in senior living. The dream of on-demand care is a reality, but we need partners like you to make that dream really come to life. So we invite you to come with us on this journey. as we bring on-demand care to those in need.
And if you need to get a hold of myself or David, here's our contact information. I'm a big proponent of LinkedIn. If you guys are using it, please link into me. I would love to link into you. Like I said, we have to collaborate. In order to innovate, we need to learn together how we can do this. Thank you very much. I appreciate it, guys.